Good morning, everyone. I'm Kendra Kopanis with Generate Health, and I want to welcome you to our webinar, Navigating COVID-19 for Moms and Babies. We are thrilled that you're joining us. The numbers of attendees keep going up as we speak, so I'm going to share some welcome and opening remarks, and then we will get into a panel presentation from our speakers. We will summarize some of the action items we've heard and then go into questions and answers. I want to share some housekeeping information. Because of the number of attendees, last we saw the registrations were close to 300, that we have muted all attendee lines. However, we do really want and encourage the interaction and engagement. So we want your questions and we want your information sharing. To do that, there's two functions. One, there's a Q&A box. So questions for panelists, please post in the Q&A box, and our staff are collecting and organizing those for the Q&A period. We will address the questions at the end in the Q&A section. For information sharing, resource information, please put that in the chat box. We're going to compile that and be able to share it out after this call. So we really encourage you to use the chat box to share information and resources, and the Q&A for questions. We are recording this so it can be accessed by others later. And I asked for your patience as we are not polished and pros at using this technology yet, but I know that in this moment everyone is not letting the imperfections get in the way of this critical resource sharing. We are, as Generate Health, we're a coalition, and we were founded to mobilize the region around the health of moms and babies. And specifically, our mission is to advance racial equity in pregnancy outcomes, family well-being, and community health. And during this pandemic and this crisis, we see our role to continue to be a convener, to help facilitate sharing of information about the needs in the community, the resources, and coordinating collective action to address those. Essentially, we are seeing this webinar as crowdsourcing in real time to identify needs, resources, and solutions to the challenges that our community and organizations are facing. We also want to bring to this conversation a racial equity lens. How can our community be thoughtful and responsive to ensure that COVID-19 doesn't further exacerbate racial disparities? And it is a wake-up call that the first 2 deaths in our region are Black women. So we were really overwhelmed with the response to the number of people signing up for this call. We just put this out Monday, but we are always humbled by this maternal child health community. We appreciate the direct service organizations and their efforts to care for their patients and clients while protecting the health of their staff. Really challenging times that you're all facing, and for community members who are stepping up and helping their neighbors. It's very inspiring to work with so many folks. We know there's a wealth of information in this community about the needs, ideas, and possible solutions. So please share those again in the chat box and in the Q&A for questions for our panelists. Today's webinar is focused on covering pregnancy care delivery perspectives, community-based support services, experiences, as well as the role of state and federal policy and what we know today currently. Before I introduce the panelists and kind of give an overview of the agenda, I want to take a moment on behalf of Generate Health to dedicate this webinar today to Judy Wilson Griffin. For those of you who follow our social media and receive our emails, you have no doubt seen our tribute to Judy's leadership of our coalition and her leadership and incredible contributions to the maternal child health community. This is just the kind of gathering and work that Judy would have championed. She touched so many lives of moms and babies, as well as colleagues in this field. And we look to her wisdom and her spirit of collaborative action as guiding light in this time. So thank you for allowing us that moment of dedication for Judy. So our agenda today, we'll start with an overview of COVID-19 and pregnancy and move into additional information about pregnancy support during pregnancy, labor, and delivery, and from True Kelman, and then look at the role of support services for moms and babies from the Moms Line perspective, Kim Martino-Sexton, and Great Circle with their home-based services, Jennifer Wickersham. Sue will bring us some federal and state policy information and help to kind of pull together some of what she's hearing from the other panelists. So what I will do is formally introduce the panelists all up front, and then as we move through the panel, I'll just give you the cue by name. So Catherine Matthews, Dr. Catherine Matthews is Associate Professor and Research Division Director at the Department of Obstetrics, Gynecology, and Women's Health at St. Louis University School of Medicine. In addition to being a physician, Catherine has an MPH and an MBA. She brings a lot of different perspectives to her role as a physician. Brittany True-Kelman, Certified Professional Midwife, and founder and executive director of Jamal Birth Village. It's our second speaker, followed by Kim Martino-Sexton, Community Outreach Coordinator for Perinatal Services at SSM St. Mary's Hospital. Jennifer Wickersham, licensed professional counselor, is Associate Director of Home and Community-Based Services in the Eastern Region for Great Circle. And Susan Kendig, a women's health nurse practitioner and attorney, is the Women's Health Integration Specialist at SSM Health St. Mary's. Okay, so I'm going to now turn it to Catherine to start us off.
Thank you, Kendra, and thank you everyone for being here. Can you hear me okay? Thanks. I hope you'll permit me also a brief tribute to Judy. I moved to St. Louis in 1998, and at that time I was working at Grace Hill, now Affinia, and delivering at Barnes Jewish Hospital. And Judy and Pam Lesser were two of the people who made me feel really welcomed and supported in that work. And when I transitioned to St. Mary's in SLU in 2012, 2013, I remember being at a meeting with our SSM colleagues and seeing them across the room. And I have this clear memory of Judy smiling and waving. And so to me, I still see that. I see Judy smiling and waving. And I want to just also reflect on what it means for me to be at a Jesuit institution and at SSM. I think we've thought a lot at SLU about what community means and how we stay in community even as we are remote. And then we had a wonderful mindfulness sharing from St. Mary's yesterday about the importance of breathing and taking that time to check in with ourselves, how we're feeling, knowing what we can let go of, and knowing what we need to be present to. So in that spirit, I know you're all probably as up as I am on the official information coming out about pregnancy, and the summary being that at this point, we don't think that pregnant women are at more risk. We remain watchful because in general with things like influenza or pneumonia, pregnant women can get more sick. But at this point, there's nothing specific saying that pregnant women are more at risk with COVID-19 than the rest of the population. I think what I've been focused on, and I think that True is thinking about this as well, is how we provide appropriate care and support during this time, because the role of our hospitals is really transitioning. We need our hospitals to be available in terms of beds and who's coming in and out of the building for those people who become ill with COVID-19 and need to be in intensive care and under watchful care. And so we are moving to places within prenatal care where we're decreasing the number of times we're asking women to come on into the hospital for we want people to come in for routine testing and the Tdap vaccine and the flu vaccine and ultrasounds. But in those other times where we just want to check in with you, we are working as fast as we can to be able to do those visits remotely, so that we're not asking a mom to leave her kids at home, to come in by herself, and to wait for visits. So that's where a lot of my energy has been. I think the other thing that I've seen out there on social media is the idea that women will be delivering alone. So I did call our labor and delivery last night at St. Mary's Hospital, and at this time for women coming in for deliveries, the current policy is having one single identified support person to be with you. So it would be one person. We all acknowledge that things change rapidly, so I'm not saying that how long this might remain in place, but that's the policy as of me checking in last night. So that's really the big overview that I wanted to give. I spent a lot of time yesterday looking at my own clinics Friday, figuring out who needed to come in, and calling women and just checking in. And I think that kind of care, the being in touch, is what we really should be emphasizing all the time and really need to emphasize now.
Thank you, Catherine. I want to move to True, who brings the perspective of caring for pregnant women in the community settings, and ask you to share what you're seeing, experiencing, and any asks you have of community.
Yes, thank you, Kendra. Good morning, everyone, and thank you so much for taking some time out of your schedule to join us and just to discuss different ways that we can support expecting families at this time. So what we've been experiencing currently at Jamal Birth Village is a huge influx in wanting to transfer to home birth services and having an out-of-hospital birthing experience, primarily due to the honest rising cases of COVID-19, but also just due to the fear that many expecting people will not be able to have a support person there, and also having the increased possibility of having their labor being rushed with more intervention so that beds could be freed up for other people who may need them. We've also had an increase in requests for support services, utilities and rent, as well as formula, diapers, and wipes for people who can't access them. So the protocols that we are implementing at this time are quite a few. We are expanding our services to provide telemedicine support through midwifery care primarily, where we can provide those prenatal care services virtually and assist different patients across the region who maybe cannot get in to see their current provider at the time, or if their appointments have been pushed back, or if they're kind of in limbo between wanting to stay where they are with their provider or going to the home birth route. So we're providing those midwifery care appointments. We've assisted some of our current clients with having blood pressure cuffs, fetal Dopplers, and also tape measurers so that they can provide their own prenatal assessment while we're doing their virtual appointments. As well, we are really walking expecting people through the process of what home birth care looks like. The unique thing about out-of-hospital midwifery care is that we spend, about 12 prenatal visits getting to know the client and their family, their needs, their wants, their fears, what are their health challenges, and we build up this very trusting relationship. As we know, when you have fear in birth, it can, cause certain issues. And so what midwives across the nation are actually facing is we have women who are about 36, sometimes 38 weeks pregnant, wanting to switch over, but it allows us a very short window of time to get them caught up on everything that we need to in order to have a very safe, well-educated, and informed birth. So what we're doing is really checking our schedules and our availability, working together as midwives across the state to see who can take a traditional clients who can provide prenatal care versus who can do deliveries. We are waiving deposit fees, and we are extending our payment plans versus payments being due in full for services at 36 weeks. We are allowing people to extend their payment plans to postpartum if they are low risk, do not have any health complications, and are a good fit for home birth care. So one thing that we all should think about if you do encounter a patient who is low risk and they do qualify for out-of-hospital midwifery care is we are requiring that these patients show up with their entire medical records in hand so that we can really fast-track them being implemented into care, and so we can make sure both mom and baby are safe. The World Health Organization as well as ACOG have recently released statements saying that they are encouraging people who are low risk and do not have symptoms of COVID-19. They are encouraging them to seek out of-hospital midwifery, whether it's at a home birth or a birth center, and that's just, it really helps for people to feel more comfortable knowing those different things. So that's pretty much everything that I can give as far as what home birth midwifery is looking like right now. Midwives are a bit overwhelmed, and I'll just speak briefly on the fact that in the state of Missouri, certified professional midwives such as myself, we do not have licensure. So that means that we cannot bill Medicaid. That means that we can bill private insurance, but clients have to pay upfront and then be reimbursed. So that provides a barrier. So we are working to see if we can find some emergency ways to make sure that people can afford to pay at this time, or midwives can be reimbursed. What we need support with is getting more kits for expecting families who are making the switch or using Jama Birth Village for interim care until they can get to their providers. So we need kits with fetal Dopplers, blood pressure cuffs, and tape measures to be delivered to the homes of those people. So the last thing that I'll mention is doula care services have increased, and at this time, we just heard many hospital policies are saying one or no. People can be present at the birth. So what we are recommending is that doulas provide virtual care. So we are encouraging people to reach out to the St. Louis Doulas of Color Collective Agency to receive that virtual doula care support, which can be pro bono or no cost. So those are the things that I can offer at this time.
Thank you, True. Takes a moment to unmute and mute ourselves, so I appreciate your patience. I think, True, you mentioned really the stress and the fears and anxieties that are coming up, and I think that flows really well into our next speaker, Kim Martino-Sexton, who coordinates the Moms Line. And so, Kim, if you'll talk about the services that are available and what you're needing for the Moms Line.
Hi, everyone. So the Moms Line, as most of you know, we provide peer telephone support, and we also provide in-person moms groups, which we have moved our in-person moms groups to moms group calls, and that's been going really well. We've had an increase of calls to the Moms Line of people reaching out to me directly, emails, a lot of pregnant women calling, just expressing concern about all the unknown and wanting to get support, to hear from other women who might have some suggestions or support. And so we've got 92 volunteers at this point who are supporting moms on the phone, whether that be the one-to-one postpartum peer support, and then we've got our co-facilitators who are helping with our moms group calls. The best way to find out information about those moms group calls, because they seem to be pretty popular right now, the moms who are calling in asking for support are more interested in our moms group calls than one-to-one peer support at the moment. I think because they're wanting to hear, like, from more than one person, what's happening, what do people know, how to get themselves supported. And so the best way to find out information is to look at our website, SSM Moms Group. If you Google SSM Moms Line, it'll take you to a page, and you can find, and right at the top of our website, it says how to learn more information about our moms groups or peer telephone support. Of course, women can always just call the 314-768-MOMS line to learn more about support. I think what I would ask you all, is to let moms know that this is an option to get connection and support. I know that we're all aware how isolating it can be with a newborn. We just have, increased that 100-fold by, everyone now staying in place. And so the isolation is so much greater. And that's what we're hearing from moms on the calls and women who are calling in, people who, they're separated from their support system, especially if they don't live with them, wondering how to get support for pregnant women who are calling in, who are due, a lot of them who called in are due in the next few weeks. And they're trying to figure out how and what is safe in terms of support, because they had family members coming in to help. And so their whole dynamic has changed. As we all know, the whole world is changing. And so, we're want women to know that we're here to offer a level of connection and support. And our goal with the Moms Line always is to, be very clear that we're peer support, and then help them get connected to other levels of support with so many of you who are, joining us today. And I know I've been reaching out, trying to learn what support is looking like, because so much of our services were in person and in home. And so I appreciate as people are responding. And that's the other thing I'd like to learn is, how is everybody else pivoting and changing and supporting moms? Really grateful to Jamal Birth Village and the new protocols and everything they're putting in place so that we can meet the needs of families who are calling in, who need access to diapers and formula, and really appreciate the work that the St. Louis Area Diaper Bank is doing and everybody's doing. And so, for me, the ask is, let women know that we're here. We're happy to be that starting point in helping them get connected to support. And then I really want to know how it's changing for everyone. What are you doing? What does connection look like? What's the best way for me to get women connected to these other levels of community support?
Thank you, Kim. That leads us right into another speaker, which is Jennifer Wickersham, who coordinates community home-based support services for pregnant women and new families. So Jennifer, if you talk about what Great Circle is seeing, the needs in your families, and how Great Circle's responding, and what kinds of things you're needing.
Thank you, Kim. I'm going to be adding a little bit more to what Kim was sharing. Am I being heard? Just want to make sure. Okay. All right. So thank you, everybody, for coming. I think the numbers that we're presenting here shows testament in our priorities and to continuing to serve our moms, our babies, and their families. So it's most admirable. So thank you. So Great Circle, we have made a lot of shifts to accommodate our moms, babies, and families across the, our entire agency. So we've kind of, shifted from being home visitors, school visitors, to virtual visitors, curbside visitors, because we are dropping off diapers to moms and trying to provide that support in that way. St. Louis Diaper Bank is a great resource that you could reach out to, and I will be sharing links in our group chat so that you can copy and paste those for reference. Also, I think too, what's important is, we have to look at the medical side, but I think in terms of really being there as virtual visitors, it's important to realize that we are their lifeline, and we are a lifeline that can connect them to the resources and supports they need. So in terms of providing that, I think having a focal point is important. So when you are having a virtual visit or a telephone call, to kind of have some structure to that time. For instance, you could, like a brief health assessment, how's mom doing, how's baby doing, how are the other family members doing in the home? And look and see if there's any symptoms to be, being presented and what steps to take from there. Also with the medical health is kind of providing the support of reality switching to possible virtual prenatal visits and check-ins, and how you can prepare them mentally and emotionally and what's it's going to look like for them. I feel that knowledge is power, and the more that they have that increased understanding and awareness, the acceptance is going to be there better for them. Also just, assessing for basic needs, what they need, also planning a schedule with nutrition and diet and just amount of food and how you ration that out, because these are the realities for everybody. Another area I would like to focus on is the mental health side, kind of gauging where their anxiety's at, if there's depressed mood. And as Kim was talking about, isolation and how that's affecting them, and how they can maybe step out of that isolation a little bit through using technology, through using Facebook and seeing if there's using Facebook groups that you can join. So it's not just all friends and family, because that can become overwhelming as well, but extending yourself out through Facebook groups. What I would love to know is if there's any virtual parenting groups that could be provided in the group chat. And if there's substance use concerns, to address those and keep that in mind. And also brain breaks, relaxation, how they can take breaks, because we don't know how many children are in each home. They're going to be shifting their children to e-learning, plus their babies, and maybe possibly being pregnant all at the same time. So these are just reality stressors, and it's more heightened with isolation and dealing through COVID-19. And I will provide resources and links into the group chat. Thank you all.
Thank you, Jennifer. We appreciate that. I saw a question come in about any state policy levers, and just in time, our next panelist is Sue Kendig, who is connected to state and federal policy efforts. And so I'm going to turn it over to Sue to kind of speak to what you see opportunities or things that are moving that might impact moms and babies from the policy standpoint.
Thanks, Kendra. And, I'm glad to have that question about policy levers, because, we're talking about the here and now and what is happening right now in terms of policy to help support not only mothers and babies, but all of our families and all individuals. But I think as I was listening to you all, I think we also need to think about some of the challenges that we're experiencing right now and how we can learn from these challenges to help inform policy once the crisis is over. So I'd invite us to consider both of those things. And just listening, first of all, the policy world changes almost minute to minute. So for example, this morning we all woke up to the news that Congress had reached a deal on the $2 trillion package to address coronavirus. While much of that seems to be targeting, obviously economic items, there was some language that I know I had been asked about last week that talked about incorporating things to help support healthcare workers in terms of childcare and so forth. We don't know if any of that's in because it hasn't been released yet. So I think as these multi-page documents come out, it's going to take a while to weed through and see how that is really impacting pregnant women and children. That being said, there are some things that I was kind of taking notes as everybody else was speaking that I think might be worth mentioning. So you're going to hear me rustling papers because I was sort of printing out the answers as we were talking. But, you know, Dr. Matthews had noted that it doesn't seem to be that there are increased risks for pregnant women at this point. Some of the other literature is suggesting maybe, or we don't know. So one of the things I wanted to bring to our attention is University of California, San Francisco has upped a pregnancy coronavirus outcomes registry, codename Priority, which stands for, which pulls out letters from all of those words, obviously. So we can make that link available if there are healthcare providers who are working with pregnant women who are affected by coronavirus. That might be something to consider, hooking them up with the registry so that we can learn better how this does affect pregnancy. Some of the other things that I heard a few of you bringing up, and I think telehealth is, you know, obviously we're having more and more attention be paid to telehealth right now in terms of utilizing that for our prenatal visits, particularly for low-risk patients, or even possibly substituting that for women who are stable. And, you know, I'm hearing in other states as well, and I would assume that's true here in Missouri, that behavioral health services are being offered via telehealth. And interestingly, the behavioral health providers who have been doing that, some have reported they have really liked it because it gives them a better snapshot of the home and the home environment as opposed to people coming into the office too. So they really get much more feedback about what's going on in real time, which I thought was interesting. In Missouri, there have been several requirements waived to make telehealth more accessible. And Missouri Medicaid does pay for telehealth. So some of the things that they've done is waive the requirement that physicians, providers must have an established relationship with the patient before providing services via telehealth, which may open the door for a newly pregnant woman to access routine prenatal care initially, that first visit possibly, waiving the co-payment for any services provided by telehealth. Interestingly, allowing quarantined providers to provide telehealth services from their home. So if a provider has been exposed and is on a 14-day quarantine and they are well and choose to do so, that's something that's an option. And also waiving the requirement that in order to treat patients through use of telemedicine or telehealth in Missouri, that healthcare providers would be fully licensed to practice in the state, and they would allow providers to bill for telehealth service as long as they're licensed in the state in which they practice. So trying to open doors to having more providers available as the crisis grows, our healthcare provider workforce becomes exhausted, or we have people exposed who can't go to work. And you can find all of those things on the MoHealthNet website. So I think that's a really important thing to think about. And some of the things that I thought about in terms of telehealth as I was listening to you all talk, and this is one area that I think is really ripe for innovation in maternal child health. So for example, you know, we all know the good work that Integrated Health Network has been leading in terms of the centering models and the success and the documented success of centering models. Well, you can't really have centering during pregnancy, but I'm wondering if there are ways to think about how we can do that using a virtual platform. You know, some of the schools have been doing things like Google Chats and so forth. Is that something that if women have access to those kinds of services might be available, that we could actually track how well that goes, so that in the future that may be a model that can help bring women together in different ways. Some of the other things that you talked about, one of the questions that came up was doulas as healthcare providers. How do we define doulas? And there has been a lot of work in Missouri and nationwide about how do we pay for community health worker services? How do we pay for doula services? All of those types of things. So as hospitals are having those discussions about limiting support people coming in with women, it's really actually pretty good timing to think about how doulas are classified in terms of whether they are allowed to come in and be with women or not during this time, and does that then negate the woman having her partner there as a support person? So I think we need to think about that, and again, it gives us another chance to document the effectiveness of those models, as well as to think about in this time, how do we prepare people should they be coming into the hospitals? How do we prepare them for their own personal protection, as well as protecting people that are already in the hospitals or in the birth setting? Along those lines, we've all heard about the shortage of protective devices, and there is more and more pressure nationally for the president to invoke his powers to force corporations to manufacture, but we haven't had that come down yet. However, when I was listening to True talk, and sort of put this in your back pocket, True, because I think you can respond, you know, when I'm through with this. But you know, one of the things I thought about, if women are asking about more home births because of the fear of going to the hospital and shortages and so forth, if we're having the shortages of personal protection equipment in hospitals and healthcare settings, what does that mean for home birth providers? And, you know, so I think we need to be thinking about assuring that whoever is interacting with patients and going out into our communities has the means should they need it. Yes, I'm seeing Governor Parson needs to release the state stockpile. There were a number of things online this morning about that as well. So those are some of the things that I thought about. And again, True brought up the point about paying for certified professional midwives. That is something that is not unique to Missouri, but it is, you know, playing out, and True, you can correct me on this one too, but it's playing out in other states like Missouri, where the availability of different types of providers may be limited because of our lack of licensing or regulation in the states. And so this is also a good time to look at what are our outcomes, and to really be able to show what was happening during this crisis and how it affected maternal health during this period. I think, some of the other things I wanted to mention, and I just got this within the last 2 days from Mo Health Net, and you all may know about this already, but I'm going to go ahead and bring it up. First of all, as part of the Family First Act, Missouri is issuing pandemic food stamp supplemental and SNAP benefits, which means that all households currently eligible for SNAP are going to receive the maximum benefits, and that will start with their benefit coming up in April. They have also received, the Department of Social Services has also been approved for a waiver from the Department of Agriculture to extend SNAP certification periods for 6 months for those people who need to recertify during March, April, and May. So again, placing priority on food access for patients. And the other thing for families, there have been some policies in Missouri that look to address child care, opening up additional child care, allowing child care agencies to increase to 1/3 of their capacity and to take school-age children. and to allow for temporary care for preschool and school-age children, issuing short-term licenses after a minimal safety inspection for a 45-day period, and those can be extended as well. And likewise, extending some of the child care subsidies for programs eligible for child care subsidies for 90 days. There has also been a waiver of, there has also been some action around WIC. Bear with me as I shuffle my papers. Where the in-person requirements for WIC for WIC eligibility and so forth are being waived. There's been a loosening of or actually a broadening of the types of food that people can access on WIC because of shortages. So extending the different brands of peanut butter, the type of eggs that people can purchase with their WIC accounts, those types of things to keep WIC and food accessible for pregnant women and young families. And that's about it for now.
Thank you very much, Sue. Appreciate that. We're going to move into addressing questions and answers. I wanted to first ask Kim if you would kind of describe more about Mom's Line, what this, oops, I was muted. Can you, hopefully I'm not muted anymore. Okay. Kim, I want to turn it over to you to ask you to describe the Mom's Line services. There was a question about really wanting better understanding of what the Mom's Line does.
Sure. So the Mom's Line, we provide peer telephone support for moms, and we do that by matching a mom with one of our trained peer coaches. And so we have 92 volunteers who are moms who have gone through our 16-hour training and become, we call them postpartum peer coaches. Really, they should be called perinatal peer coaches because they're working with women during pregnancy and postpartum who are experiencing any form of mood and anxiety issue. Moms don't have to be diagnosed. Moms can reach out to us just because they're not feeling like themselves. They would just like some more connection. They're experiencing some worry, sadness, overwhelm. The number one thing that moms say when they call us is, I'm just not feeling like myself, and I'd like to talk to someone about that. So moms call into our warm line or helpline. They are asked to leave a message. So it's available for them to leave a message 24 hours a day because we know that moms are often up at 3 a.m. Thinking about getting themselves support, and they'll leave a message then. And then I return all phone calls that come into the Mom's Line within 24 hours. I do an intake that takes about 45 minutes. It's a non-clinical intake. I am not clinical. The Mom's Line is completely peer supported, but I'll do that intake, and then I'll match a mom with a peer coach who's had a similar experience. So if a mom calling in is experiencing anxiety, then I'll match her with one of our peer coaches who has experienced anxiety throughout her journey. If a mom calls in and is experiencing depression or any combination of things, then I'll match her with one of our postpartum peer coaches who's had a similar experience. We have a weighted matching system, so we try to match moms with our peer coaches who have similar number of children if possible. The number one weighted match is the mood and anxiety piece, and then from there, there's different weights that we go ahead and match our peer coaches. And then what happens is the mom and the peer coach talk weekly with some texting in between. That decision is made between the two of them as to when they're going to talk. And the calls are typically about an hour long. And that relationship can last as long as the mom is interested in that relationship lasting. Our average peer telephone, postpartum peer coach and mom relationship is approximately 6 months long. But it can be as long as a year. It can be as short as, this is all mom driven, what she needs. So that's the peer telephone coach piece of it. And then the other piece of support that we have is the moms groups that meet in different areas around the St. Louis area, which have all now moved to moms group calls. Those moms group calls are being offered at the same time that our moms groups were offered. Each moms group has kind of its own little culture, and women are encouraged and welcome to join any of those moms group calls. They are at all different times of the day. They were held at all different locations. We have different co-facilitators at those different meetings. And now we've moved those moms group calls to a call-in. So it is just a call. We're using a Skype phone number and a code. We're not doing video. We probably won't go to video because we have a percentage of our moms who are accessing us through track phones and phones that may not support video. And so we want to be very careful to offer the support and have it accessible to all the moms who call in. We do have, and so moms who are attending our moms group calls prior to this, and sorry if I'm making this confusing, moms don't have to go through the moms line to attend the moms groups. And typically they were not. So it's very interesting. At one point when we first started this, we thought all moms would call the moms line first and then get connected to our peer support on the phone or moms groups. And actually what's happened is very different, those are very different lines of support, if you will. Got women who call in and want to get connected to peer telephone support, and women who just show up because they found out about a mom's group and they come to them. And we have a small percentage of our moms group moms who then choose peer telephone support because it's another level for them. So right now, we're doing something a little different. Our moms who are interested in getting connected to the moms group calls do need to complete a pre-screen because we do want to protect those groups. And so we're not just putting out a phone number for our moms group calls. If anyone's interested in them, they can call the moms line. I'll talk with the mom, do a pre-screen, and then I can offer her access into that coded call whichever day of the week she wants. She actually will get on our list, and all of our past moms group attendees are receiving emails with the Skype number and code for each of the meetings. Sorry.
Can I interrupt you for a second? Would you
Please.
put into the chat box to all attendees the contact information for the Moms Line, and if there's a website that people could go to get more information, that would be really helpful.
Yes, I will do that.
Great.
So hopefully that helps
explain
what we're doing.
Yeah.
I will add that in that 45 minutes that I get with a mom when we're doing her pre-screen, so that's where I use an EPDS, the Edinburgh Postnatal Depression Scale, as an assessment. Also, part of that conversation is what types of support does she have? What types of support is she looking for? And then I can help her get connected to different levels of care that she might need, whether that's community support, professional support, whether that's a psychiatry at either at Barnes, perinatal behavioral health service, or it really, our goal is to provide zip code located connections for mom and do that in a warm handoff type of way. So we're not just giving her a list. It's really listening and talking with her. We try to limit when we're getting moms connected to support. I'm not giving her 10 things. It's listening. What are the top 2 priorities she has right now, and then helping her with that, and then moving through that process.
Thank you very much, Kim. I'm going to move into some other questions. There's a couple of questions that really revolve around more specific ways hospitals are, we talked a lot about whether doulas are just defined as healthcare or personal support. And so if there's any specific from their panelists about the hospitals that you're aware of, how they're defining doulas, and then also ways in which hospitals are preparing and responding to the fears and concerns about coming in to deliver in the hospital.
Hi, so I know Sue and I appreciate you commenting on this. I'm not sure yet where our local hospitals are in terms of how they classify doulas. So I do just think this is a moment to bring this up as an important piece of care for our women, especially with the doulas of color group. And in terms of home birth, I just wanted to put out a couple things. Hospitals, obviously, as they're planning for beds, they're taking into account that some care must go on, including deliveries and appropriate care of high-risk women who have to be admitted before they deliver. I just wanted, there are just a couple absolute contraindications, so reasons not to be considering a home birth according to our organization. So if the baby is not head down, if you have twins or higher order, or anyone who's had a prior C-section, we really want those women and their infants to be monitored within a setting where we can respond quickly if something goes wrong. Many deliveries are very, very safe, but every once in a while things happen very quickly, and so we want to make sure that we're attentive to these risk situations and continuing to provide appropriate care in the appropriate place.
Thank you. True.
This is True. I just want to chime in about the doula care piece in regards to the hospital, and then I also want to chime in about what Sue mentioned in regards to the medicine and the different things that are available to home birth midwives as supplies change, and also just support what was just mentioned about what risk-appropriate care looks like in a low-risk setting for people considering home birth. So from my understanding, looking at the different hospital policies across the region, doulas have been recognized as health professionals, and we actually have a group of doulas who have been organizing to not necessarily give pushback, but to allow that to be considered when these policies are erected. So doulas have been recognized. They aren't intentionally being barred from being with their clients, but as we try to, flatten the curve and really limit the spread of COVID-19, many hospitals are still saying one person only. It cannot be your doula shows up in the first part of your labor and then she goes for lunch to take a break and then the husband comes in. It has to be that consistent person to limit the spread. So in that regard, it does put the patients in a very, difficult situation to decide. But once again, the St. Louis Doulas of Color Collective, as well as Jama Birth Village Doulas, has just jumped on board to say that we still will provide that virtual care, being on the phone or on an iPad, whatever means the woman has, so that we can continue to provide care for her. So I have not seen hospitals instinctively saying, no, your doula cannot be there. I have seen a policy that came out that stated that doulas being present would be on a case-by-case basis based on the charge nurse. And so in situations like that, I do think that that is unsafe for a decision to be made based upon one person when a policy has already been in place. So that's pretty much the perspective that I can give. It's left up to the mom based on the hospital policy. We've been encouraging our clients who receive prenatal care through Jama Birth Village and plan on delivering at a hospital, we've encouraged them to call prior to going to deliver to see if there has been any updated changes, since these policies are changing overnight, essentially, in some manners. So in regards to home birth midwifery care, the World Health Organization has released a statement of how midwives should screen not only our patients, but also to screen anyone in the home by phone prior to actually going to the home for a home birth or for a prenatal visit. So that's us asking them to take their temperature, asking about their association or contact with people who have symptoms or who have tested positive for COVID-19. It's also us asking, have they traveled recently and what those regions are. So we are also bringing an extra pair of clothes that we change into once we leave our vehicles and before we enter into our client's home. And then we also have a very strict sanitizing rule. We are sectioning off our different materials that we're using. If it's just a prenatal visit, we just take those things that are needed for that visit, putting them in a Ziploc bag, using them at that visit, and sanitizing them prior to putting them into a new bag. And once again, we are purchasing or encouraging our clients to purchase their own items to use to also prevent the spread. Currently, we are not facing an emergent issue with having a cap put on the medical supplies that we have. At Jama, we have a really good supply that can carry us for the next 6 months. Other home birth midwives, if they're low on supplies, they've been gathering together to do larger orders. So at this time, we are not in threat of not having the proper things that are needed to attend home birth. So the last thing that I would like to mention is when we think about women who qualify for low risk home birth midwifery care, as is what was mentioned before, we would encourage women who have an uncontrolled case of gestational diabetes, if there's any issues with hypertension, if a woman has had a previous cesarean section and has not had a successful VBAC, we are encouraging people in those particular group settings to definitely have a hospital delivery and maybe see a midwife at that hospital setting if they want to attend a VBAC. Jama Birth Village very strongly practices risk-appropriate care, and so we have a screening process. If challenges come up in pregnancy, we will co-facilitate care with the physician, and if it is deemed that that client is at risk, we will elevate that care to a higher risk position and transfer that person out of care. And we also have very proactive protocols in labor and delivery, in ensuring that if any red flags come up or even just yellow flags, that we're very proactive with providing transfers. And the last thing is that what makes home birth midwifery safe is that we have healthy relationships with providers and hospitals in the area, and that the birthing person is within a certain radius of a hospital with a maternity ward. So in the event that there's an issue with mama or baby, we can have a very swift and safe transfer at that time.
Thank you, True. Very helpful. I saw a comment earlier about, and this would be to you and Catherine as well, that a question about or comment about the importance of breastfeeding. And I think I've read that there's, we haven't seen any transmission vertically from pregnant woman to newborn, and that it's not seeming to be a risk to breastfeed. And so I just want to maybe have you guys clarify what you know about breastfeeding in this for COVID-19.
Yeah, I would like to share what we know based on research right now is that, yes, if a mom is positive for COVID-19, she cannot transmit that virus based on what we know right now through her breast milk. And just as it was mentioned earlier, COVID-19 does not cross the placental barrier. So if a mom is pregnant, she cannot pass that along to her baby. So again, the World Health Organization has encouraged mothers who are COVID-19 pregnant, COVID-19 positive, and quarantining at home per se. They're encouraging to still use those hygiene practices while nursing their baby. So making sure to wash their hands and sanitize their hands prior to nursing their baby, wearing a mask over their face while they're nursing their baby so that those airborne droplets don't, cover the baby or drop on the baby while nursing. And they're also just encouraging them to, feel comfortable and safe with nursing more frequently, because we know that whenever moms are able to breastfeed, those antibodies in their milk help to build up baby's immune system, which can, support the baby and not contracting the virus. So one additional thing that I haven't seen in any statements is that if there's any other people in the home, just encouraging them to help to keep the home sanitized and clean to prevent the spread from mama to baby.
And it's really important to encourage and support breastfeeding, because we are seeing it challenging to find and formula. I mean, we know all the benefits of breastfeeding, but also folks in the community are having trouble accessing formula. So we need to be able to encourage and support moms through breastfeeding.
And Kendra, if I can just say one last thing.
Sure.
Jamalberg Village has an oversupply of formula and breast pumps. And yesterday, 2 of our volunteers went out across the St. Louis region and delivered formula for people who are feeding their babies via formula. And so if you know of any of your clients or patients who cannot access formula, or if they can't make it to the WIC office to get their vouchers, we are doing a very safe and protected doorstep delivery for those people at no cost. And they just need to email us or message us through Facebook or IG. We'll do a brief intake and we'll get that delivered to them within 48 hours.
Thank you, True. Very helpful.
You're welcome.
We had Alderwoman Christine Ingracia on the line, and as a alderperson representing parts of South St. Louis, including Clinton Peabody, she's very concerned and wants to know how best she can support pregnant women in her ward. How can a non-health or social service organization help the constituents in their neighborhood? Anybody have thoughts about that? And this is an opportunity for anyone on the call to post in the chat box ideas and thoughts you have for Alderwoman Ingracia.
I did answer in the chat.
Okay.
I just love that she is being available and concerned. And I think for our political leaders to let people know that they are resource people, they don't have to know all the answers, but they can find the answers. I think, again, making sure that we emphasize how we are a community and being in touch with people, it has a healing power in and of itself. And then I gave her my cell phone so that if she gets questions that she would like help with, I'm available.
Thank you. We had a question. Sue, were you going to jump in?
Yeah, I was going to jump into that as well, because I agree with everything that Catherine said, and would agree. I'm happy to be available to you as well. I also think, as I said when we started out, we need to pay attention as to what we learn now to help inform future policies. And I think as an alderwoman, you are positioned so well to really understand what people in your ward are experiencing right now, and working toward how we can then take these learnings so that we can craft policy to truly help people. And I'll send you my cell phone as well, because I just don't think this should be a one and done. We're going to address it now and then go back to business as usual. I think we need to take what we learn and keep making things better for our citizens. And all of that being said, I don't know if there's anyone on from the city or county health departments or St. Charles health departments, but I think that you all should be commended, and thank you for the proactive stance that you're taking as a region to keep citizens in our area as safe as possible. And I don't know if you're hearing thanks enough, so I want to make sure that we recognize our leaders for that.
Thank you, Sue. I think this question I want to pose to all the attendees to weigh in on the chat box. Someone specifically asked what was happening with shelters, what shelters were doing in the area to keep their employees and clients safe during this time. So if you have resources or information about that, please post that in the chat box to all attendees. There's also a question, since we're moving to telehealth, teleservice delivery, how are we addressing technology barriers? And Kim, you spoke to this a little bit about not, using just regular phone connections, but any other insights or thoughts from the panelists about addressing access barriers when there's technology gaps in communities? Jennifer, is that something you want to weigh in on?
Sure. Can you hear me? Sorry, I had to step away for a second. Yes, basically we are using, we're encouraging families in terms of using their phones. We're using Zoom. You can also use the Google option with that. Also, if it's, FaceTime, if that's your last resort, then you have to go FaceTime, and just doing telephone calls. It's really whatever works for the family and what's ever user friendly for them in terms of that. So basically in regards to like healthy families, child division, let's see, fostering futures, children's service fund, basically everyone's in agreement in terms with contracts that use what the family can use and what is user friendly to them. And just be, stay HIPAA compliant as much as possible, but they are being forgivable in these circumstances.
Great, thanks. The shelter question again to put out to all attendees is, what are homeless shelters doing to protect those who are staying in the shelter as well as their employees and volunteers? So if you have any insights and information, please share that in the chat box. There's a question maybe to you, Sue, about with the in-person WIC requirement waived, how do families get their checks or their vouchers? And are the extended WIC items available now? How do families know what those items are?
Again, I'm going by something that was sent to me from Mo HealthNet yesterday. So I think that, and what they are saying is for families they're referring them to the TELLINK number. So 1-800-835-5465. I think everybody's probably familiar with that. They are, they don't say anything about how to get the checks. So there's nothing in here that I'm seeing as to, oh, here we go. No, they don't say how they're going to get the checks how they're going to get the information to the women. So I don't know if they're planning on the cards or, just loading cards or what they're doing, but we can, again, I think we can get clarification and send that out to y'all. Great.
And for any of these questions that I'm posing to the panel, if someone on the call has information, please put it in the chat to all attendees. And we'll also work, as Sue said, to get answers to send out after the call. Question about resources for those without transportation, that Uber and Lyft is unavailable, and bus and trains are cutting back and limiting. And so any insights from panelists about transportation and what you're seeing for your clients? Then I'll throw that to the crowd for crowdsourcing answers. So please feel free to add anything in the chat box that we can share out after this call. There was another question raised about concern about vaccinations in infants, and already a disparity in vaccination rates for babies, and concern that this will exacerbate it. What can we do to ensure families are able to get vaccinated during this time for regular vaccine, important to newborns?
You know, that's one of the things I think really speaks again to future planning, because we are spending, you know, we're putting a lot of energy into dealing with crisis on a day-to-day basis. But I think that question speaks to what are we going to do as the curve flattens and hopefully trails off. We need to have a plan in place to make sure that those immunizations are caught up, that people understand how some of these services that are being available during this crisis, such as the maximum benefit of food stamps, the differences in WIC, we need to make sure there's a plan in place so that we can transition to a non-crisis mode and address all of these things that may have been put on hold, particularly in communities that are less resourced or may not have the readily available information. So I think that's something collectively we probably need to be thinking about, and certainly probably have a discussion at Generate Health as well.
Great, thank you. Back to some other questions. There was a question about whether doulas could use donated iPads and laptops to help with virtual care. And True, there's been some requests for your contact information to be shared in the chat box. If you don't have access to do that, we can get that posted to all the attendees. Oh, somebody did that. Okay.
Yes, thanks. Yes, so definitely, I do believe that that can be helpful. Some doulas have, within the St. Louis Doulas of Color Collective, they are an initiative with Jama Birth Village. So it's a collective of Black and brown doulas who have their own doula businesses, and they come together in this collective to advance affordable and accessible access to doula care services. So currently the collective, some of the doulas may have iPads and phones and some don't have like an iPad where they can use for their virtual care services. Jama Birth Village doulas do not have their own iPads for virtual care services. So we've been resorting to using our cell phones and using our laptops. So definitely that is something that can be very helpful at this time, so that we can have a streamlined process and protocol for providing the virtual doula care services to expecting people at this time. And if you are interested in providing those resources for our staff doulas as well as our collective, you can definitely contact us by emailing me directly, which is true@jamabirthvillage.org, and that's just TRU. You can also just visit our website, jamabirthvillage.org, and click on the donate tab, and you can see the various different ways that you can connect with us to make sure that we have those resources as soon as possible to really support people who need those virtual doula services at this time. And I just want to thank whoever asked that question and came up with it, because it's really ideal. And as a small community-based organization, you know, we do our best to make sure we have all that we need, and sometimes we really, really do need the support of the community to meet that match and provide that care. So I thank you for that.
Thank you, True. We have a attendee who is very concerned about St. Louis going the way of New York City and having to give birth alone and stay there alone. And curious if there's hospitals in our area that'll be less likely to do that, and how. And I think, True, you talked about, you know, you encourage your clients to check with the hospitals regularly that they're planning to deliver with to see what the policies are. but any advice, guidance you would offer to this person who is fearful?
Yes, and so I just first want to validate your feelings. It's very, very scary to first be in a hospital where we are hearing that nurses and doctors don't have the protective equipment that they need, and then being in a space where the virus may be in the building. And so it's okay, to feel those emotions. And I just want to acknowledge that. I did also see that announcement made that there are currently no visitors that are allowed in the hospital. So I really just want to encourage you to take the time that you do have at this moment before you do go into delivery to try your best to get prepared so that you are not alone. So even if there isn't any physical support that you can have at this time in person, you can once again make sure that you contact doulas in your region. Ancient Song Doula Services is a doula collective in New York, and they have been on top of the COVID-19 crisis. And I'm very sure that whether you're close to them or a little bit farther away, that they can give you some support options while making sure that you have a virtual doula, whether it's by phone or by iPad. What I really want to share with you in preparation is birth planning. So, and I like to call them birth preference plans. What do you prefer to happen? So have a best case scenario and a worst case scenario. So the World Health Organization released a infographic that I shared on Jamal's page this morning, that despite the COVID-19 crisis, every pregnant and expecting individual still deserves and has the same rights that you would have when we're not going through this pandemic. So the right to be informed is not just about informed consent, where someone is saying, well, this is what we're going to do, sign here. It's really about giving you a choice of whether or not you want certain medications, such as an epidural, giving you a choice, and making sure that you are not rushed and that interventions that are not medically unnecessary, that they aren't posed upon you. So I really want to encourage you to sit down and look at a birthing plan. And if you email us, we can send you a template so that you can go in with your preferences lined out, and then have a plan B. If labor stalls and things need to be sped up, Pitocin is often used for those, to augment labor, to help to speed things up if baby needs a little push. And so many people don't know that you can start Pitocin at a lower level instead of starting at a high level, which can sometimes impact baby. So kind of do a little bit of research in that arena. You can also look into taking a virtual childbirth education class if you haven't done so, to better understand how labor unfolds so you can feel more prepared. And finally, one thing that I want to mention is having some birth advocacy cards or birth affirmation cards. So kind of put down some common hospital complications that some people may experience, and on the other side of the card, kind of have those choices and options already lined out, because with the hospital staff kind of being overwhelmed in this position right now, it cannot be intentional, but sometimes they may not give you your full list of options. And if you say, well, hey, I have this on here for this particular issue, what about this? Can I try this option? And you already have it handy with you. So please just try those things. What I encouraged our families of yesterday on a live feed was try not to get overwhelmed with the news. Maybe check the news once a day or twice a day for about 10 minutes, get your updates, and then try to rest, stay hydrated, make sure you're getting 80 to 100 ounces of water a day, 75 to 80 grams of protein a day, do intentional rest, get a little bit of movement, and that can help to set a good foundation for a successful full-term pregnancy and hopefully uncomplicated labor and delivery. So I'm really sending you my best at this time, and please reach out if you need additional support.
Thank you so much, True. We are really going to need to call this webinar to a close. We will continue to look at the questions that we didn't get to, and in our follow-up resource information that we share out, we will include addressing any of those unresolved questions. We know that there are so many issues and needs to be discussed that we are going to host a webinar each week this day and time to continue this discussion. So we'll be looking at the themes that came up that we're hearing from our partners about what needs to be addressed in our next call. So stay tuned for more information about that. I want to ask everyone in your networks, in your contacts, to encourage the practicing of social distancing and the preventive measures. Hospitals are asking us to please encourage that. They really need all of us on the front line spreading that message to limit the spread of this disease. I also want to close with thanking our panelists today for short notice coming on, sharing your insights and perspectives. I want to thank everyone who's been participating, sharing your wisdom and your resources in the chat box. It's an enormous amount of information that we have, and we will be putting that back out to everyone. And I want to thank our staff at Generate Health for organizing and planning and executing this, specifically Sarah, Abby, Rose, Laura, Carrie, and our Kayla. So following this call, you can expect to receive a link to the webinar recording, a compilation of the information and resources shared, and a quick survey to give us some feedback. We will really encourage you to widely share the information that we have that we share out with the link and the resources. So again, the themes we heard today are going to shape our content for the next webinar, Wednesday, April 1st at 10 a.m. Thank you to everybody and take care.